Diagnosis in medicine. In medicine is significantly different from that in other specialties. It is concerned with the lives of the patients. Right methods of treatment depend upon right methods of diagnosis. A wrong diagnosis is the shortest way to wrong treatment. Treatment costs the patients morbidity and or mortality. Morbidity and or mortality costs the treating person uh, uh, punishment by the law and by Allah, our Creator. This proposal for diagnosis in any medical specialty was done by me in 1969 during the last 2 years of my undergraduate medical study. An example of the collective group answer of my students' class about the ordered causes of the thyroid gland diseases was: student number one mentioned congenital, inflammatory, neoplastic, and autoimmune. After side discussion of the group of students with each other, student number two added iatrogenic and trauma. After side discussion and collective discussion of the group, student number three added nutritional and secondary. Student number four added idiopathic and endocrine. Student number five added goiter. There was no suggestion for other than these from the whole group of the undergraduate students in my class. What's meant by the word diagnosis? Diagnosis is the least number of words arranged in phrase form clearly expressing a disease in a patient. The phrase form of words lacks the rules of the English grammar. A closed form of words keeps the rules of the English sentence grammar. Objectives of a diagnosis. It should clearly answer three questions. What is the disease? What's the disease? And did that disease affect the physiological function or not? Change its function or not? The answer of what is the disease is an anatomical diagnosis, anatomical component of the diagnosis. What's the disease is a pathological component of the diagnosis. Did the disease affect a function or not is a functional or physiological component of the disease concerning complications. Diagnosis components are anatomical, pathological, and functional. An example of diagnosis: the mitral stenosis, the component is only anatomical. Rheumatic heart is only pathological. Rheumatic heart mitral stenosis contains the anatomical and pathological, but didn't answer the third question. Rheumatic heart mitral stenosis compensated. It is a complete uh, diagnosis containing the three answers the three questions. Rheumatic heart mitral stenosis with right side heart failure is a complete diagnosis. Rheumatic heart mitral stenosis with subacute bacterial endocarditis, it is a complete diagnosis. Anatomical diagnosis. No need for further subclassification. The disease is here, it is here. Functional diagnosis. Also, there is no need for subclassification, either the normal function or disrupted function. The function is concerned with functional diagnosis is not the cause of the disease, but it reflects the impact of the disease on the body functions. As an example, Hashimoto thyroiditis is a specific non-organismal chronic inflammatory disease, autoimmune disease, an inflammatory disease. It causes thyroid hyperfunction in early stage and causes thyroid hypofunction in its later stage. Pathological diagnosis, functional or organic. Functional is psychic or psychiatric, or organic, the first step of classification. Organic causes either congenital or acquired. The congenital, some congenital diseases may not appear after birth, may appear later on in life. Examples of congenital delayed diagnosis of a disease. Acquired causes. The acquired causes may be acute or chronic. Acute causes acute inflammation, trauma, and vascular. Causes chronic inflammation, neoplasms, and degeneration. Inflammation might be organismal or non-organismal. The organismal may be specific or non-specific, and the non-organismal also may be specific or non-specific. Specific inflammation, the causative agent induces unique pathological changes which cannot be induced by any other agent. Specific organismal infections might be viral, bacterial, parasitic, or fungal. Examples of specific viral infections. Specific bacterial infections. Specific parasitic infections. Specific fungal infections. Non-organismal inflammation might be physical, like heating, coldness, or radiation. Might be chemical, like acids and alkalis. Might be autoimmune. Vascular causes might be hemorrhagic or occlusive. The hemorrhagic might be systemic or local. The local may be arterial, venous, or capillary. The occlusive may be thrombotic, embolic, or iatrogenic. Traumatic causes might be accidental, suicidal, or iatrogenic. Neoplastic causes might be benign or malignant. The malignant might be secondary, carcinoma or sarcoma. The primary may be carcinoma, sarcoma, or lymphoma. Degenerative causes might be changing the function, like hyperfunction or hypofunction, or changing the anatomy and histology and function by aging, changes, storage diseases, and metabolic changes. The answer of the question of enumeration of the thyroid gland disease. There are no psychiatric etiological causes of the thyroid gland disease. Congenital thyroid gland disease. Babies of uncontrolled maternal hyperthyroidism, babies of over-controlled maternal hyperthyroidism, babies of uncontrolled maternal hypothyroidism, babies of over-controlled maternal hypothyroidism, thyroid gland aplasia, non-formation or absent gland, lingual or ectopic thyroid gland, thyroglossal cyst, thyroglossal fistula, congenital hyperthyroidism, thyroid goiter. Thyroiditis, viral, bacterial, parasitic, fungal, or thyroiditis acute, chronic, specific, or non-specific. Non-specific thermal, chemical, or radiological thyroiditis. Specific autoimmune diseases like Hashimoto's thyroiditis and Riedl's or Legner's thyroiditis. Trauma, accidental, suicidal, or iatrogenic. Thyroid gland vascular accidents. Sudden hemorrhage inside a thyroid gland cyst leading to sudden increase in size with acute serious pressure manifestations. Degeneration. Uh, Physiological or parenchymatous goiter, colloid goiter, nodular goiter, primary and secondary toxic goiter, thyroid hypofunction, cretinism in children and myxedema in adults, metabolic storage diseases, drug-related thyroid gland hypofunction, drug-related thyroid gland hyperfunction, thyroid gland neoplasms, gland adenoma, benign neoplasm, secondary malignant carcinoma deposits from distant source, papillary carcinoma, follicular carcinoma, anaplastic carcinoma, and medullary carcinoma of the parafollicular cells or the T cells carcinoma, lymphoma. The diagnosis on using the proposal was completely different from the diagnosis of group thinking with each other and going to the final diagnosis of the students like what they proposed at the class. The proposal advantages. It helps ordered arrangement of the basic science and medical data. It broadlines the spectrum of the database of medical students and practitioners. It is helpful for studying clinical practice at all levels and all specialties of medical field. It's helpful uh, for undergraduate and or postgraduate medical studies. It's helpful for answering written, oral, or clinical questions in medical experience or in the examinations. It is helpful for clinical practice for professionals in all fields of medicine. Good luck and best wishes.